So Andrew, the costs in healthcare keep on rising. What's going on?
Keep mounting, don't they? 3 lifestyle choices are driving 4 chronic diseases that make up 80% of our health budget. Those 3 are smoking, lack of exercise, and poor nutrition. They're driving chronic diseases like heart and lung disease, cancer, and diabetes. That is the area to tackle, and to tackle fast, along with better integrated care across our social services sector and our primary healthcare sector.
So with all the data that's being collected across interactions with patients, sitting across multiple agencies, surely there's a lot that can be done here.
I think there's a lot more that can be done with the handoffs, and whether you're going in for a hip replacement or an arthroscopy, the handoffs between the specialist, the hospital administration, your physio afterwards, the sharing of that data, appropriately done with the patient's best interests, both informing the patient prior to procedures for prevention, plus in the treatment of the condition and post-treatment care, can be improved dramatically.
And taking into consideration the fact that most of us are walking around with some kind of a device attached to us.
It's going to increase, isn't it? Whether it's a wearable on your wrist, whether it's remote monitoring while you're sleeping to check your sleep condition, it's going to increase, it can increase, the flow of data is going to increase. And importantly, we can start to apply artificial intelligence and robotics in a very, very constructive way. It's rich for good returns in this area. Clearly there are concerns with privacy, and importantly, we need to demystify the fact that this isn't about robotics in aged care centres. This is allowing automation and robotics to relieve the nurse, the frontline carer, of administrative tasks so they can spend more time with the elderly or with the patient.
Okay, so the 3 things from your perspective are, how do we improve the experience for the patients, because we can utilize all the information we're collecting with the through interactions with them. Second is around how do we provide more integrated healthcare, so better outcomes as part of the interaction between the various agencies. And the third one is really around applying artificial intelligence in and machine learning to deliver the outcomes for the patient.
That's it.